Hello, and welcome to the organs of the muscular system. So here we will be identifying major surface muscles, the joints they span, and the actions they cause at those joints. First, we should begin with a discussion of how muscles attach to bones and how they work. Skeletal muscles cause movements by exerting force on tendons. So remember, the tendons are receiving the force that's created in each individual sarcomere and the length of the myofibrils and the length of each muscle fiber, which are bundled into fascicles. And the connective tissues around all of those layers extend to transmit the force to the tendons, which attach to the bones. Please note, muscles cause movement by pulling on bones or other structures. Muscles never pull. So in order to get opposite motions at any given joint, there must be at least two muscles that are opposing each other or are causing opposite actions. One muscle pulls in one direction to create one action at the joint, for example, flexion, and another muscle crossing the same joint and usually on the opposite surface, when it contracts, pulls the bones in the opposite direction to cause the opposite motion, in this case, extension. Now note that articulating bones usually do not move equally in response to contracting muscles. What do we mean by that? The bone that stays relatively stationary when the muscle contracts is called the origin. So the origin refers to one of the bones to which the muscle is attached. The other bone or bones to which the muscle is attached that tends to move when the muscle contracts is called the insertion. So every muscle has at least one origin bone and a different insertion bone because all muscles must span a joint in order to cause motion. All muscles must cross over a joint or cross over the space between two bones. If muscles were attached to one bone, as muscles contract, they pull one end of a bone toward the other, and that would snap the bone. So to cause movement, bones move from one to the other. Insertion always moves toward the origin at a joint when the muscle attached to both muscles contracts. The actions of a muscle are the main movements that occur during contraction. So one muscle might be the muscle of flexion at a given joint, another muscle might be the muscle of extension, etc. The two muscles that are often used to demonstrate these features are the biceps brachii and the triceps brachii of the brachial region. So you can see that the bicep brachii covers the anterior surface of the arm or the brachial region. It has its origins in the scapula, and the insertion or other attachment point for the bicep brachii is the radius. So this muscle actually crosses two joints. From the scapula to the humerus is one joint. We call that the shoulder joint or the glenohumeral joint. And then between the humerus and the radius and ulna is another joint. That's the elbow joint. So this muscle actually can cause action at two different joints. Similarly, the tricep brachii covers the opposite surface but on the same joints. So it also has origins in the scapula and humerus and inserts into the ulna. It also crosses the shoulder and elbow joint. But because these muscles are on opposite sides of the same joints, they cause opposite motions when they contract. The joints act as a fulcrum while the muscles provide the force of movement, and the load is the weight of the object being moved or the bone. So the fulcrum is the point where the contraction causes movement, and the bones act as levers. Most muscles do not work in isolation. Movements are often the result of several muscles acting as a group. Together, they smooth out motions. They also provide the accuracy of motions. Most muscles are arranged in opposing or antagonistic pairs at joints. So as we saw on the previous slide, one muscle covers one surface of the bone and its antagonist will cover the opposite surface. The prime mover, which is also an agonist, is the muscle responsible for that action when it contracts. Other agonists may support the prime mover. So there's a primary muscle responsible for that action, and other muscles may create the same action and act as other agonists. Antagonist muscles oppose the action of the prime mover, so they cause the opposite action when they contract. Also note that the agonist for one movement is the antagonist for the opposite motion. So in the example of the bicep and tricep brachii, for elbow and arm flexion, the bicep brachii would be an agonist because it causes flexion at the shoulder and arm or elbow joints. Its antagonist is the tricep brachii because it opposes the bicep brachii. It also causes extension at the same joints. Conversely, the prime mover and agonist of elbow and arm extension is the triceps brachii because that's what that muscle does when it contracts, and its antagonist is a bicep brachii, which causes flexion. Synergists are muscles that prevent unwanted movements or otherwise aid in the movement, and these include fixators, muscles that stabilize the origin of the prime mover. So depending upon the movement required, many muscles may act as prime movers, antagonists, synergists, or fixators. Everyone, I'd like you to meet Muscle Man, or Muscle Person, if you will. And this is an anterior view of the principal superficial skeletal muscles. Don't get scared. You are only responsible for identifying and labeling the ones that are highlighted. And I'm quickly going to go through them with you. And for some of them, you will need to know the origin, insertion, joints crossed, and actions, but have a general description of these. And if it might help, please refer to your textbook. There is a table there or a few tables that go through how to name muscles, and it might help you remember the name of the muscles based on their shape or maybe their location or the bones to which they are attached or what they resemble. Different criteria are used to name muscles. All right, let's go through them. On the left of the diagram and to the right of Muscle Man, we have the serratus anterior muscles, so named because they look like a sawtooth pattern. And these are abdominal muscles just inferior to that axillary and pectoral region. Then we have the muscles that make up the medial aspect of the anterior trunk. These are called the rectus abdominis muscles. They are so named rectus because they run parallel to the midline or longitudinally. When these muscles are well defined, they make what's called the six-pack. And in a small percentage of the population, they actually have divisions that cause them to have an 8-pack. Aren't they special? Lateral to the rectus abdominis muscles, we have the external obliques. So the external obliques make up the rest of the anterior abdominal wall and also make up most of the lateral abdominal wall. Not visible on this diagram, but deep to the external obliques are two other muscle layers that finish up the anterior abdominal wall. These are the internal obliques and the transverse abdominis muscles. So these three muscles make up a large percentage of the abdominal wall, and we'll talk about them later. Going down the diagram, we have the sartorius in the thigh region, and this is an oblique muscle called the Taylor's muscle, so named because it is a muscle that contracts when one crosses their legs. It is also the longest muscle in the body. In the anterior thigh or femoral region, we have the quadriceps femoris group. Quadriceps because it's made up of 4 muscles. We have the vastus lateralis, the rectus femoris, the vastus medialis, all of which are visible superficially. And deep to these, we have the vastus intermedius. So these 4 muscles work together and cover most of the anterior thigh. The tendon of the quad group passes over the patella, and inserts into the tibia, your shin bone. All right, in this view, we can actually see two posterior muscles, the gastrocnemius and soleus. They are very broad muscles, so they are visible from the anterior view, but you'll see them more clearly on the next slide. On the right of the diagram and the left of our subject, we have the epicranial aponeurosis. Now, I just highlighted this one because it's an example of an aponeurosis, that broad band of connective tissue, or super tendon, if you will, that attaches more than one muscle. So in this case, it's attaching the occipital frontalis muscle frontal belly to the occipital frontalis muscle occipital belly posteriorly, and it essentially covers the skull. Below that, we have a label for the orbicularis oculi. So this is a muscle that encircles the eye. The masseter muscles are the cheek muscles and the muscles of chewing. And in the neck, we have the oblique, slender, sternocleidomastoid, one of my favorite muscle names. A posterior muscle that's also visible in this anterior view is the trapezius. You may have heard of the traps, and they are well defined in bodybuilders. These are these muscles that kind of poke out triangularly on the neck and blend into the shoulders. The cap of the shoulders is made up by the deltoid muscles. Covering the anterior thoracic region, we have the pectoralis major muscles, and deep to that, we have a pectoralis minor. So you have a major one, bigger, minor, smaller. We already met the muscles of the brachial region, the tricep brachii posteriorly and the bicep brachii anteriorly. And just deep to the biceps brachii is the brachialis muscle, which is actually the prime mover for elbow flexion. So it works with its agonist, the bicep brachii, to cause flexion at the elbow. As you can see, we skipped the smaller muscles of the forearm, wrist, and hand, but note the names. These are muscles that flex the wrist and the fingers. And that makes sense because they are anterior muscles. They're going to pull the wrists and the palms up towards the forearm. In the lower limb, we have the major muscle that now covers the anterior leg or crural region, and that is the tibialis anterior. That is a very thin, flat muscle that covers the tibia. This is the one you really can bruise if you trip going up the stairs, for example. Here we have a posterior view of the principal surface or superficial skeletal muscles. I mentioned on the previous slide that there's a broad aponeurosis on your scalp or on your head called the epicranial aponeurosis. So in the anterior view, we saw that it attaches to the occipital frontalis muscle, and that was the frontal belly. And in this view, you can see that same tendon extending posteriorly and attaching to the occipital belly of that same muscle. Posteriorly, you can also see the insertion of the sternocleidomastoid and a better view of the trapezius. So that muscle is so named because it has the shape of a trapezius. Hope you remember your geometry. And covers most of the superficial posterior neck, extends down into the medial back. In the posterior view, you also have a good view of the deltoid that covers the shoulder, and of course the triceps brachii. I mentioned that the gastrocnemius is a large muscle that covers the calf, so named because it means belly. So it's a double-bellied muscle, and deep to it you can see the soleus. The gastrocnemius muscle and the soleus attach via one tendon into the calcaneus via the calcaneal or Achilles tendon. You may have heard of that in Greek mythology. On the right, we have three muscles, the infraspinatus, the teres minor, and the teres major. Two of these make up what's known as a muscle group called the rotator cuff. You may have heard of it. And the main function of the rotator cuff is to stabilize the glenohumeral joint by compressing the humerus head against the glenoid cavity of the scapula. So the muscles that make up this group, often called the SITS, are the supraspinatus, the infraspinatus, the teres minor, and the subscapularis. And you may have heard of rotator cuff injuries that come from overuse of the shoulder. And then we have the latissimus dorsi, which is the broad muscle that covers most of the back of the abdominal pelvic region. Now, interestingly, this muscle inserts into the humerus, and it's called the swimmer's muscle. This is the one that extends the arm posteriorly and even hyperextends to create that swimmer dive position, or pre-dive when the hands are pulled behind the back. In this diagram, laterally you can see part of the external obliques, and then of course the rest of the abdominal cavity posteriorly is made up by the latissimus dorsi muscle. Covering the buttocks, we have the more superficial of the gluteus muscles. This is the gluteus maximus, so the biggest of the three. It covers or crosses the hip joint, and the partner to the quadriceps femoris group anteriorly is the hamstring group posteriorly, or the hamstrings. So the hamstrings are made up of three muscles: the semitendinosus, the biceps femoris, and the semimembranosus. So this is why it's important to name muscles fully, because bicep is just a descriptive term meaning two heads or two tendons, two origin points. We have a bicep muscle in the brachial region, the bicep brachii, and here we have the biceps femoris in the femoral region. The sartorius muscle we met earlier. This is an oblique one, which you can see here on its medial insertion point. So these are the main muscles that you should be able to label on this or similar diagrams. The remaining slides are for you to go over and study on your own. They give you short descriptions of the major skeletal muscles, not all of the ones that we identified on the previous two slides, but those for which you should have some detail. I gave you a list in your lesson folder of those for which you need to know the origin bone, the insertion bones, and the actions, as well as the joints that they cross, which I've tried to highlight here. So anything that's bolded, you need to know about these muscles. So I'm going to go through it really quickly, but again, it's up to you to summarize these notes and maybe refer to your textbook for more details if you are interested. All right, the masseter muscle is also called the muscle of mastication, which means chewing. This muscle works to elevate the mandible when it contracts, and when it relaxes, it allows for lowering of the jaw. So this is the main muscle we use when chewing. Here we have the sternocleidomastoid, commonly abbreviated the SCM. This muscle is so named for its origins and insertion bones. So the origins are the sternum, the sternal, the cleido is for the clavicle, and the mastoid refers to the origin, or sorry, the insertion for this muscle, which is the mastoid process of the temporal bone. So this muscle spans essentially several cervical vertebrae as well as the jaw bone. When these muscles contract, they may contract together or independently, and then they create different motions. So when they contract together, they cause flexion of the head, and when they contract independently, they cause rotation and lateral flexion of the head. Depicted on this diagram are some of the more common muscles that originate on the trunk, and these include the pectoralis major and deep to that the pectoralis minor muscles that cover most of the anterior thoracic region. We also have the anterior abdominal muscle group. We met the rectus abdominis muscles, and lateral to those we have the external obliques, and deep to that we have the internal obliques, And if you cut one more layer, you'd see the transverse abdominis muscles. Posteriorly, there was the latissimus dorsi. Separating the thoracic region from the abdominal pelvic region is that broad, flat muscle called the diaphragm. We mentioned the trapezius and the deltoid that caps the shoulder. The pectoralis major has its origins in the clavicle and sternum and in some of the costal cartilage of the ribs and inserts into the humerus. So this muscle, when it contracts, is going to pull the humerus towards the midline or towards the sternum, and that action is called adduction. As the fibers contract independently, the pectoralis major can also cause medial rotation of the arm at the shoulder joint. The antagonist, or one of the antagonists for the pectoralis major, is the deltoid muscle, as we will see later. But keep that in mind. It's easiest to study these as agonist-antagonist pairs. So here's our deltoid. Its origins are in the clavicle and scapula. It also inserts into the humerus, but on the opposite side of the pectoralis major. So the pectoralis major inserts into the medial aspect of the humerus, while you can see the deltoid inserts into the lateral aspect of the humerus. So they're going to cause action at the same joint, the shoulder joint, while the pectoralis major is causing arm adduction. The deltoid is going to pull the arm up towards the scapula and clavicle and cause arm abduction. Independently, the fibers can also contract to cause flexion or medial rotation of the upper arm at the shoulder joint. The deltoid is also important because it's a common site for intramuscular injections. Here is the lovely trapezius, and this is one of several muscles that move the pectoral girdle, including the scapula and the clavicle. Its origins are in the occipital bone of the cranium, and the insertions are down in the vertebrae, as you can see. And remember, when muscles contract, they pull the insertions toward the origins. So this muscle works to support the arm and move the scapula up. And as they contract different fibers, it can also move the scapula down, in, and out. Wow, this muscle is busy. Does all kinds of things to the scapula. Another muscle that moves the shoulder is the latissimus dorsi. It has its origins in the thoracic and lumbar vertebrae, as you can see, running the length of the trunk. Also, the sacrum and ilium of the hip bone. And interestingly, it's hard to see, but the latissimus dorsi inserts into the humerus. So again, this muscle is often called the swimmer's muscle, as it drives the arms inferiorly and posteriorly, causing extension and hyperextension at the shoulder. Also, it can adduct and medially rotate the arm at the shoulder, or turn the shoulder forward toward the midline. And closing out the muscles that make up the abdominal pelvic region, we have the rectus abdominis muscle. You can see that it has a large fascia and tendon sheath there. Its origins are in the pubic bone, and its insertions are in the ribs and sternum. So this is interesting. In this case, the origins are more inferior than the insertion, very similar to the sternocleidomastoid. So when this muscle contracts, it causes flexion of the vertebrae or flexion at the waist. It pulls the trunk down toward the ground as if you're taking a bow. Okay, the rectus abdominis muscles. It also compresses the abdomen along with the other abdominal muscles, and this compression is important for actions such as defecation, coughing, anything that requires a deep, forced exhalation. That would involve contraction of the rectus abdominis and other abdominal muscles. The external obliques make up some of the anterior and mainly the lateral parts of the abdominal wall, origins in the ribs, and insertions in the iliac crest of the hips, as well as the linea alba. And that's that band of tissue that runs right down the center between the rectus abdominis muscles. The action is to flex, again, the vertebral column, similar to the rectus abdominis muscle, and also compress the abdomen. So these muscles essentially perform the same functions. Here is a diaphragm from the inferior view, so you're looking up at it. And this is the main muscle of inspiration, or breathing in. It's a broad muscle that spans the width and breadth of the trunk, separating the thoracic region superiorly from the abdominal pelvic region inferiorly. The origins are on the inferior 6 ribs, in the anterior region, and in the lumbar vertebrae posteriorly. The insertion is more medial in the central tendon, as you can see in the diagram. This muscle attaches to the pericardium of the heart, as well as the pleura of the lungs, the parietal layers of those membranes. And its main function is to contract and pull down on the lungs, thereby increasing the volume of the thoracic cage, which leads to inhalation as the pressure inside the thoracic cage drops and causes a gradient where air will flow from the outside into your lungs. So without the contraction of the diaphragm, essentially, your breathing would be insufficient. There are accessory muscles of breathing that you will meet in second semester when we look at the respiratory system, but the primary muscle of breathing is the diaphragm. It contracts for inhalation, it relaxes for exhalation. Here we have some of the more common muscles of the extremities. We've met the pair, the bicep brachii and the tricep brachii. We also introduced the brachialis, which is the prime mover of elbow flexion. We also have the wrist and hand, or carpi and digitorum, extensors and flexors. And if you look at those two main diagrams of the major muscles of the body, you'll notice that the flexors are on the anterior surface of the lower limb, and the flexors are posterior, which makes sense because, again, muscles work in pairs and oppose each other because they cover opposite sides of the same joints. In the lower limb, we have the gluteus maximus, the hamstring group, the quadriceps femoris group, the tibialis anterior, the gastrocnemius, and the soleus. This is a transverse section through the arm, and you can see that these are pretty fleshy muscles. Anteriorly, we have the two heads of the bicep brachii muscle, and deep to that we have the brachialis. So these two muscles work together to cause elbow flexion. Posteriorly, we have the heads of the tricep brachii muscle that makes up the bulk of the posterior brachial region. All right, here we have muscles that move the radius and ulna. So we talked about the bicep brachii, whose origins are in the scapula. Insertion is in the radius bone of the forearm. And when it contracts, it causes action potentially at two joints, depending on which other muscles are working with it. So at the elbow, it causes flexion, pulling the radius and the forearm towards the shoulder. And at the shoulder itself, it pulls the arm anteriorly and superiorly. So recall that that is flexion at the shoulder, to lift one's arm up as in asking a question. Again, the brachialis is deep to the bicep brachii. Its origins are in the humerus. It's going to pull its insertion, the ulna, toward the humerus, and is the prime mover of flexion of the forearm at the elbow. The antagonist to the bicep brachii and brachialis is the triceps brachii muscle, or this muscle is the agonist of arm and elbow extension. So the origins here are the scapula, and one of the muscle heads also insert into the proximal humerus. The insertion is in the olecranon of the ulna. So remember, that's the prominence that forms the tip of your elbow. So even though it inserts into a different bone than the brachii and brachialis, it's going to cause the same action because it's pulling the entire region, the forearm, toward the scapula, but posteriorly. That's why it causes extension at the elbow and lowers the arm at the shoulder, pulling it back down and posterior in the action called extension. Moving inferiorly, we now have the muscles that move the femur. The gluteus maximus covers most of the buttocks region. It has its origins in the iliac crest of the hip bone, as you can see, as well as the sacrum and coccyx medially. The insertion is in the femur, so the gluteus maximus covers the hip joint. As it contracts, because it's a posterior surface muscle, it's going to pull the femur posteriorly toward the hip. And that action, if you can imagine, is extension at the hip. Depending on which fibers are contracting and its work with other muscles, it also rotates the thigh laterally or outward at the hip joint. The muscle group that covers the anterior surface of the thigh or femoral region is the quadriceps femoris group. And again, the four muscles that make up this group are the rectus femoris, the vastus lateralis, the deeper vastus intermedius, and the medial vastus medialis. Collectively, the origins of these muscles include the iliac spine of the hip bone, okay, so that ridge of the iliac part of the hip, and the proximal femur. The insertion is way down past the knee joint via the patellar ligament into the patella and proximal tibia anteriorly. Now, when this group contracts, it's going to cause the lower limb to be pulled up towards the trunk or the hip anteriorly. That is flexion at the hip. But at the same time, this group inserts into the tibia and pulls the leg or the crural region towards the hip. And that action is extension at the knee. So watch out for the quadriceps femoris group. It causes two actions because it crosses two joints, but they are opposite actions at these two joints. At the hip, the quads cause flexion, but at the knee, they cause extension, and that's because your knee joint is backwards compared to your elbow joint. The antagonist to the quadriceps femoris is not only the gluteus maximus muscle at the hip joint, because remember the gluteus maximus causes extension at the hip, so the quadriceps femoris would be its antagonist as it causes hip flexion, but another posterior group that also extends the hip is the hamstring group. The hamstrings are made up of the biceps femoris, semitendinosus, and semimembranosus. The origins are also in the hip, but in the ischial tuberosities of the hip bone, so that's posteriorly. And the insertion is below the knee in the proximal tibia and fibula bones. And because this group has its origins and insertions on the posterior surface of the femoral region, it's going to oppose the actions of the quadriceps femoris group. So at the hip, the hamstrings cause extension, and at the knee, they're going to pull the tibia and fibula up towards the hip, but posteriorly, and that is now knee flexion. Knee flexion. Moving down now to the muscles that move the femur, the tibia, and the fibula, we have the major anterior leg muscle called the tibialis anterior. Easy name to remember. The origin is in, guess what? The tibia. And the insertion is in the first cuneiform tarsal bone and the first metatarsal of the sole area. So this muscle is anterior. It's going to pull the superior portion of the foot up towards the tibia. So that's going to cause that action called dorsiflexion at the ankle, where the toes are pulled upward. It also works to invert the foot. Inversion is when the foot is rotated medially and the lateral side of the foot is down and the more medial part of the foot is up. Go back to joints and movements to review that one. Imagine people walking on the side of their feet. That's inversion. And now we have our final set of muscles, the muscles that form the posterior aspect of the crural region or the sural muscles. Together they work to plantar flex the foot at the ankle joint. So the gastrocnemius and soleus muscles function as one and are often called the gastrosoleus muscle. The gastrocnemius has its origins in the femur, the capsule of the knee, and the head of the fibula. The soleus has origins in the fibula and tibia. They both insert into the calcaneus by way of a common tendon called the Achilles tendon or calcaneal tendon. Now, because the gastrocnemius is posterior and spans the knee joint, it causes the same action as the hamstrings at the knee. So the gastrocnemius is going to pull the leg up towards the thigh, and that is knee flexion. So the hamstrings and gastrocnemius are agonists of flexion at the knee, and of course are antagonists of the quadriceps femoris group, which causes extension at the knee. The gastrocnemius and soleus both span the ankle joint, so they both work together to pull the heel up toward the tibia, and that action is plantar flexion. It results in the toes being pointed down. All right, that's it. So I hope you enjoyed these muscles. Please put them into pairs. It would be the easiest way to study them. So we had the bicep and tricep brachii for action at the shoulder and elbow joints. We had the pectoralis major and deltoid muscle for actions at the shoulder with respect to lateral and medial movements, abduction and adduction respectively. Then at the hip joint, we had the gastrocnemius and hamstrings antagonistic to the quadriceps femoris group. At the knee, we had the hamstrings and gastrocnemius, which are agonists for knee flexion and are antagonists of the quadriceps femoris group at the knee, which causes knee extension. And then at the ankle, we had the gastrocnemius and soleus, which cause plantar flexion, and the antagonist there on the anterior surface was the tibialis anterior, which created dorsiflexion. I hope you enjoyed that. Use a study table to put these into pairs. Again, noting the origin and insertion of the ones we mentioned, the joints they span, as well as their actions.